Okay, in this video, we are going to look at the lower extremity. But before we start the lower extremity, let me just mention this bone here. It's an outlier bone. It is the only bone in the body that doesn't articulate or make a joint with any other bone in the body. So this bone is the hyoid bone. Right? When we take a look at the hyoid bone, it has just a few major landmarks. We have a body, we have a greater horn, and then there are these lesser horns. Okay, so that's here in the throat, called the hyoid bone. When we look at the lower extremity, let's take a look at what we have. We have the pelvic girdle, and this specific part right here is a fossa, right? Because it's a smooth depression. It's called the iliac fossa. Here is the sacrum. This bone is called the ilium, as we can see here, ilium. This bone is called the pubic bone or pubis, and then down below we have the ischium. So we have the ilium, the pubic, and the ischium. When these three fuse, it creates this bone, sometimes called the no-name bone or the innominate bone. And it also fuses and forms this bowl, this deep vinegar bowl called the acetabulum or acetabular fossa, which is really what's the socket for the ball and socket joint for the head of the femur to articulate with. Here's the fifth lumbar vertebrae. Here's the last disc. Here's the sacrum. Here's the coccyx. The sacrum is about 5 fused segments. The coccyx is about 3 to 5 fused segments. This is the iliac crest, which is where the belt line would be, the iliac crest. Here is the anterior superior iliac spine, also known as the ASIS, anterior superior iliac spine. And then right here is the anterior inferior iliac spine, ASIS, AIIS, anterior superior iliac spine, anterior inferior iliac spine. Here's the pubic symphysis, that is fibrocartilage, same thing that the discs are made up, fibrocartilage, strongest cartilage in the body. Here's the obturator foramen. This right here is the pelvic inlet. This is the pelvic inlet. Iliac fossa would be here. Pubis would be here. Obturator foramen would be here. What is the highlighted section here? Iliac fossa. ASIS is this here. AIIS, anterior inferior iliac spine, is here. ASIS is a landmark where the sartorius muscle, the longest muscle in the body, originates. The AIIS is where the rectus femoris, which is one of your quadricep muscles, originates. So here's the ASIS, here's the AIIS. The base of the sacrum, they call that the sacral ala or ala of the sacrum. Here's the acetabular fossa, also known as the acetabulum, and here's the iliac fossa. The importance of the iliac fossa when we cover muscles, there's a muscle that originates here called the iliacus. It is the primary hip flexor. Make sure you watch my videos on ranges of motion so you know what hip flexion looks like and hip extension looks like. I actually have an older video that I demonstrate these, and I also talk about muscles that perform those actions. Here is remember the spinous processes are in the cervical, thoracic, and lumbar vertebrae. The sacrum does not have spinous processes, but they have the median sacral crest. They also have sacral foramina. These holes are called sacral foramina. The sacral hiatus is this opening down here at the bottom. And the ala of the sacrum is up here on the top. The superior articulating process would be here and here. Okay, now we're looking at the pelvic bone from the lateral view. And here is the lateral view because here's the acetabulum. Now we have to figure out what's anterior and what's posterior. The trick to that is when you see this big scoop, the big scoop is more posterior, okay? This big scoop is called the greater sciatic notch. And if there's a greater sciatic notch, there's going to be a lesser sciatic notch. And this little bump here is going to separate the greater sciatic notch from the lesser sciatic notch, and it's called the ischial spine, the ischial spine. Here's the acetabulum. Here's the ilium. Here's the pubic bone. Here's the obturator foramen. This is the ischium. And on the bottom is the ischial tuberosity, which is where your hamstring muscles originate. Your hamstring muscles are the two semisisters, the semitendinosus, semimembranosus, and the long head of the bicep femoris will originate on the ischial tuberosity, which is at the bottom of the ischium. So the ischial tuberosity is here. It's the actual bone that makes contact with the chair when you sit on a chair. Now we're looking at it from the inside, right? Because you don't see the acetabulum. But we do see the greater sciatic notch, and we see the lesser sciatic notch, and there's the ischial spine. So here's the iliac crest. The reason why it's important to know anterior to posterior, because you could then say, well, if that's the iliac crest and this is posterior, this is the posterior superior iliac spine. This is the posterior inferior iliac spine. Here's the anterior superior iliac spine, the anterior inferior iliac spine. Okay, there's the pubic bone. This is where the pubic symphysis would be. Here's your obturator foramen, and here's the ischium. And back here is the ischial tuberosity. So now, here's a perfect example of why you have to be able to differentiate what view we're looking at it from. So here's the acetabulum. So now we're looking at the from the lateral view. Here's that notch. So everything back here is posterior. Everything back in front here is anterior. So what is this? Is the iliac crest. That blue section is the PSIS. Lesser sciatic notch is down here. PIIS would be here. Here's the acetabulum. Okay, now we're looking at the longest bone in the body, which is the femur. Here's the femoral head. Here's the femoral neck. Remember, in the humerus, there was a greater and lesser tubercle. In the femur, there's a greater and lesser trochanter. So here's the greater trochanter. Here's the lesser trochanter. Here's the intertrochanteric line. The intertrochanteric crest is on the posterior. Here's the adductor tubercle. The adductor tubercle is going to be an attachment for the adductor magnus muscle. There's an adductor magnus, adductor longus, and adductor brevis. So the adductor tubercle is for the adductor magnus insertion. The patellar surface is just the groove for the kneecap, which is the patella. When there's degeneration, here, that's where people get a lot of clicking when they extend and flex the knee. The degeneration of the knee, typically the name of that condition when there's lots of clicking there, is called chondromalacia patella. Chondromalacia patella. The greater trochanter is an important insertion site for 6 deep lateral rotator muscles. The 6 deep lateral rotator muscles, I call them please, go, go quietly. Just take the first letter of each, please, G-O, go, G-O, go, quietly, Q. Piriformis, that's please, gemellus superior, gemellus inferior, obturator internus, obturator externus, and quadratus femoris. Those are the please, go, go quietly muscles. They all in trochanter. They're all external rotators of the femur. Okay, now we're looking at the posterior femur. Again, head of the humerus, neck of the humerus, greater and lesser trochanter. Here's the pectineal line. Here's the gluteal tuberosity, linea aspera, this sharp ridge back here, linea aspera. Here's the medial supracondylar line, a lateral supracondylar line, an intercondylar fossa, intercondylar between the two condyles, a lateral and medial condyle. Always remember the head of the femur projects medially because it's got to project into the acetabulum. So that's going to face the medial condyle. When we look at the knee from the posterior, here's the distal femur. Here's the distal, the tibia and the fibula. The tibia is medial. The fibula is lateral. Here's the head of the fibula. The fibula descends and becomes the lateral malleolus. The tibia descends and becomes the medial malleolus. Here's the calcaneus, which is your heel bone, and then you have the metatarsals. Here's the patella. Here's the kneecap, the base and the apex. Inferior to the apex, there's a bump on the proximal tibia called the tibial tuberosity. The significance of it is that's where your quadricep muscles will insert. The tibial tubercle or tibial tuberosity is in the same horizontal plane as the head of the fibula. Notice the fibula descends and becomes the lateral malleolus. The tibia descends and becomes the medial malleolus. The medial malleolus and the lateral malleolus clasp the talus bone, which is one of your tarsal bones. Closer look at the knee. We can see some cartilage, some ligaments here. These are the anterior and posterior cruciate. Cruciate means cross. They do crisscross in the inside of the knee. These cruciates prevent anterior and posterior gliding of the tibia in relationship to the femur. Here is the lateral condyle of the femur, medial condyle of the femur. Remember, the fibula is the lateral bone, so that's on the near the lateral condyle of the femur. This is the head of the fibula. Here's the plateau of the tibia, or the superior articulating surface of the tibia. That's the tibia, and right there is the tibial tuberosity. The meniscus, when you have the medial and lateral meniscus, that would be here. This would be the lateral meniscus, would be the cushioning and cartilage here, and then the medial meniscus would be the cushioning here. So, there we go. So now we're looking at the blue highlighted cartilage here, the aqua color. Since the fibula is lateral, this would be the lateral meniscus, which is here. This is the lateral collateral ligament, also known as the fibular collateral ligament. And here's the tibial collateral ligament, also known as the medial collateral ligament. So this one here is the tibial collateral ligament, also known as the medial collateral ligament. The tibial collateral ligament attaches to the medial meniscus. Notice that the fibula collateral does not. There's a little gap or space here. And that's why when you damage the medial meniscus, when you damage the medial collateral, you also damage the medial meniscus, as well as the anterior cruciate. We call that the terrible triad. That's when someone is running and their feet are planted on the floor. Let's say you're playing basketball or tennis, and then they stop short and they twist and turn, and then they hear a snap or a pop in the knee. We call it the terrible triad: anterior cruciate, medial collateral ligament, medial meniscus, typically blown out. When we look at the distal end, this is the lateral condyle. Remember, the head of the femur projects medially, so this is lateral. That's the lateral condyle. That's the medial condyle. Condyles are smooth articular surfaces, so the condyles are going to articulate with the top of the tibia. Because the condyles are round and the top of the tibia is flat, you have a round surface on a flat surface, it's unstable. The knee is probably the most unstable joint in the body. So we have these collaterals and cruciates and meniscus to try and help stabilize the knee, along with the iliotibial band on the outside and lots of muscular support on the inside. Here is the patellar surface of the femur. This is where the patella glides. Here again is the articular surface of the femur. This is the tibia. You can see the anterior cruciate, posterior cruciate, head of the fibula, tibia. Now we're looking at the tibialtuberosity. There's the head of the fibula. That's the intercondylar eminence. Here's the anterior border or the crest of the tibia, and then medial and lateral malleolus. The lateral malleolus descends further distally than does the medial malleolus. And that's why inverting the foot is so much easier than everting the foot. That's why plantar flexion inversion injuries are so common of the ankle. It's kind of like slipping off a curb or slipping down the stairs. The foot rolls in and falls down. It doesn't roll out. The reason why it can't roll out is the lateral malleolus blocks it. But the medial malleolus is up higher, so the foot inverts. Okay, here's the fibular bone. Here's the tibia. There's the tibial tubercle. That's the head of the fibula. So what's below the head? The neck. So that's the neck of the fibula. Now we're looking at the tarsal bones. Remember, the carpals are in the hand. The tarsals are in the foot. The hand has 8 carpals. The foot has 7 tarsals. After the tarsals are metatarsals. And after the metatarsals are the phalanges. So this bone here, remember the great toe is the hallucis. That's the first digit, second, third, fourth, fifth digit is the pinky. So this is the 4th digit. This is the 4th metatarsal. So what's being highlighted here? These are the phalanges. Remember, you have 7 tarsals, 5 metatarsals, and then you have 14 phalanges. The reason why there's 14 is there's a proximal, a middle, and a distal for digits 2 to 5. But the great toe, much like the thumb, doesn't have a middle phalange. It only has a proximal phalange, and it has a distal phalange. Now here we're pointing to the 1st, 2nd, 3rd digit, so digit 3. From this view, this superior bone is called the talus. The inferior bone is the calcaneus. Then we have a navicular. You have a 1st, 2nd, and 3rd cuneiform. Again, 1st, 2nd, 3rd cuneiform, also known as a medial cuneiform, an intermediate cuneiform, and a lateral cuneiform. And then you have the cuboid. So again, the 7 tarsal bones, you have a talus, which is superior. That's where the medial and lateral malleolus clasp it. The inferior bone is the calcaneus, which we can see underneath. That's the heel bone. You have the navicular, just anterior to the talus. Then anterior to the navicular is the 1st, 2nd, and 3rd cuneiform, also known as a medial, intermediate, and lateral cuneiform. And then you have the cuboid here. So here we're pointing to the 1st, 2nd, 3rd. This is the 4th digit. And here's the calcaneus from the lateral view. That's the lateral malleolus. This is the talus. This is the cuboid. Okay, then here I've seen this question come up where they just want you to drag and drop, right? So here's a picture of the pelvic bone. So they want you to drag and drop every landmark associated with the pelvic bone here. So acetabulum, ischial tuberosity, posterior superior iliac spine, anterior superior iliac spine, obturator foramen, greater or lesser sciatic notch, pubic crest, iliac crest, auricular surface, ischial spine, all pelvic. Okay, the auricular surface is that junction between the sacrum and the ilium, forming the sacroiliac joint. Now you have all the landmarks of the femur: lesser trochanter, greater trochanter, inner trochanteric crest, intertrochanteric line, linea aspera, which is on the posterior, the gluteal tuberosity for the gluteal muscles to insert, the epicondyles, the condyles, the head, adductor tubercle, Popliteal surface, which is on the posterior part of the knee. Supracondylar lines, all femur. Condyles are also part of the tibia. Medial malleolus, part of the tibia. Tibialtuberosity. Lateral malleolus, part of the fibula. The head is part of the fibula. Soleal line, which is where the soleus muscle inserts. Then we look at the structures on X-ray, a little bit advanced, does involve a little bit of critical thinking, but we're looking at the femur, the tibia, and the kneecap from the lateral view. So this is the femur, here's the patella, that's the adductor tubercle right here. That little bump is the intercondylar eminence. Here's the articulous surface of the medial condyle. Here's the tibia, so anterior, the bone that sticks out is the tibialtuberosity. Here's the tibia, and then there's the fibula. Quadricep muscles are here, hamstring muscles are back here. So again, you're looking at the lateral perspective of the thigh. Patella, femur, tibia, fibula. When we look at this, you're like, what are we looking at here? This is the cervical spine, that's the cervical lordosis. So this is the C1. Now remember, C1 doesn't have a spinous process like the rest of them do. The brain is here. Here's the magnum foramen. This is the spinal cord. These are the vertebral bodies, which are anterior. And these are the spinous processes that are posterior. But remember, atlas doesn't have a vertebral body. It has an anterior arch and a posterior arch. C2 is known as axis. It has the dens, or the odontoid process. This is a cervical vertebrae. This is the vertebral prominence. This is C1, C2, 3, 4, 5, 6, C7 is 70% of the time the most prominent spinous process. So they call it the most prominent, or vertebral prominence. And then under C7 is T1, which is your first thoracic vertebrae. So a little bit of critical thinking. If you had to drag and drop these, you could figure it out. Okay, and then on bone, we've seen some of this histology. This is compact bone, which is more external. And on the inside here is trabecular bone of cancellous bone. Trabecular is more kind of like spongy type of appearance. Okay, all the way on the outside would be the periosteum, and way, way on the inside would be the medullary cavity, which is where the bone marrow is. Okay, we'll end this here. Oh, sorry, we'll do one more. And then I've also seen separating the axial skeleton from the appendicular. And again, you just drag and drop the bones that you see, probably, you know, some easier questions that you can get right. What do you see here? So in this, you could see the clavicle a little bit. You could see the humerus, the femur. You could see the tarsals. You could see the radius. But here in the axial, you can see the skull, the ribs, the sternum, the lumbar vertebrae, and the sacrum. Okay.